Everyone. I think it's a beautiful Monday morning, and I want to thank every one of us for joining this live broadcast. First of all, my name is Kayode Femi. I'm a veterinary doctor, and I work with Farmalad with a colleague, quite a handful of colleagues of mine. Fortunately for us, we have our two country managing director here with me. Of course, you'll be hearing about what it is that they do for us in Farmalad and a few things around what we are trying to officially open today. Farmalad started 2019 with one goal: to democratize animal health. We have quite a lot of issues in the animal health sector, especially in Africa. Weak infrastructure, and these go a long way to affect the farmers and the pet owners who depend on the infrastructure to ensure their livelihood or the survival of their livestock or their pets. So since 2019, we've actually been at the forefront, particularly in Nigeria, but now in Liberia, as you'll be hearing from the country managing director in Liberia and in Nigeria very soon. We've been at the forefront of advancing animal health, and what we do predominantly as an animal health business is to ensure that animals are fine, people's livestock are safe, people's livestock are fine, but more importantly, that they could go to rest knowing that things that usually affect their livestock, we can easily cater for them by ensuring easy access to affordable animal health products and services across the entire continent. Proudly, within the last 5-6 years that Farmalad has been in existence, we are servicing over 1,000 agrovet stores and over 1,000 veterinarians across the country. Fortunately for us also, early part of this year we launched into Liberia. And the interesting part about Liberia, no veterinary doctors in Liberia, but Farmalad currently now boasts of 4 veterinarians advancing animal health in Liberia. So why are we doing this? Very simple. It occurred to us early part of this year that people are losing pets for something as simple, and allow me use the word as simple as Parvovirus Enteritis. I really don't want to go into the technical details of what Parvovirus Enteritis is. Dr. Nancy will be letting us know what Parvovirus Enteritis is. But it's one of those deadly viral diseases that is preventable. We did the anti-rabies campaign last month, and we're in Liberia. We also did a couple of campaigns in Nigeria, because rabies sometimes move from animals to humans, but again, it's 100% preventable. Same as Parvovirus Enteritis. Over the last 10 years, the Nigerian pet industry has lost over $1 billion for something that could be prevented with $2 or $3. So why do we have those massive losses? Well, first of all, because solutions are not that they are scarce, but they are not readily available. And for us in Farmalad, we have taken this as our mission to ensure that solutions like this are readily available. Hence the 30 days campaign that we're going to be involved with. We held the Breeders' Conference in Jos, Nigeria in July, and somebody in the audience said he lost 28 dogs. Now the cost of these dogs may be probably cheap to some, but very expensive to some others. The cost of a pet now is ranging from, if you're in Nigeria, I believe you understand this, from 200,000 to as much as 1 million. I met somebody who lost a puppy that she bought for 1.2 million. What's the issue? Of course, parvovirus, once it affects a puppy and is endemic in Nigeria. What I mean endemic in Nigeria is that it's everywhere. Most kennels are most likely going to be having residues of these viruses just by default, because we've had a lot of pet owners. And if you're listening and you're a pet owner, you're in any of our, you can share your experience in the comment button. But again, we've been on this campaign for a while now, but we're officially starting today. And I get to hear pet owners come to our DM. They've lost 2 puppies, they've lost 3 puppies, they've lost 10 puppies. Some lose their entire litter to parvovirus enteritis. Once you start finding foul smelling feces, bloody diarrhea, etc. But Dr. Nancy will be educating us on that very shortly. You know that you're dealing with parvovirus enteritis. So why has veterinarians nationally, especially if you get to a vet clinic and your pet is suffering from parvovirus enteritis, a well-equipped veterinarian will tell you that the chances of survival is 50-50. Right, why is it? It's a viral disease. Of course, viral diseases have no cure. You can only treat symptomatically. And treating symptomatically also affords you the ability not to even attack the root cause of the problem, which is a viral disease. And once you don't attack the root cause of the disease, you can invariably lose your puppy. And a lot of pet owners have lost their puppies in that regard. So why will a vet tells you the chances of survival of parvovirus enteritis affected puppy is 50-50? It's simple. First, it's a viral disease. Secondly, there are no standard cure to viral disease, and as I said earlier, you can only treat symptomatically. But why are other vaccines that are meant to prevent parvovirus enteritis not very effective? And I'll give you 2 or 3 reasons why. The first is that as God has created us as humans and also animals, of course we believe God created humans and animals, we have this maternal derived antibody that is supposed to care for puppies. These maternal derived antibodies are passed across from the bitch, which is the female dog that gives birth to the puppy, to of course the puppies. So ideally, within that first window of protection between day 0 to probably 6 to 7 weeks, the maternal antibody is supposed to protect the puppies. But of course, we know sometimes the puppies don't have this enough. And when they do, and you administer a vaccine, the popular vaccines we have in the market, we call them DHLPP. Once you administer those vaccines to those puppies, and the maternal antibody is still active, they counteract each other and leave the puppy exposed. We have a breakthrough vaccine, and I'm going to be talking about this breakthrough vaccine shortly, but I will allow Dr. Nancy to talk about the technical details, maybe a summary of what I've said, and then we will come back to the Primodog vaccine. I'll be telling you why this campaign is very important, why the Primodog vaccine can literally save your puppies from dying of parvovirus enteritis. And then, of course, we'll be handing over to our CMD in Nigeria, who will be telling you a lot about how, because there's a raffle going on, we have a few packages for our veterinarians, incentivizing them to be part of this campaign. She'll be telling you the details of the raffles, and then, of course, we'll be picking questions from online and then from our audience. So let me hand over the mic to Dr. Nancy to talk to us about what parvovirus enteritis is, and then the technical details around Primodog.
All right, good morning, everybody. My name is Dr. Nancy, and I currently serve as the Country Managing Director for Farmalat Liberia. Just like Dr. Kayode has said, a lot has actually been said already, but then it's parvovirus, as the layman would actually just say parvo. You know, a lot of breeders, a lot of dog owners, a lot of pet owners generally would see parvo, and they already conclude that it's a dead zone. Dr. Kayode said 50-50, but at some point, actually, some vet doctors would definitely tell you that this is a 70-30 situation, and at some point, it's even an 80-20 situation. 80 being the possibility of it not making it, and 20 being the possibility of it making it at some point, you know. So it's not something that should be joked about. It's not something that we should actually just take as as it is, because it leads to a lot of losses, it leads to a lot of emotional damage. A lot of pet owners are connected to their pets in such a way that a lot of people who do not own pets might not even believe. So you see, so parvo causes a whole lot of havoc. So what is parvo? Parvo is a virus, is a viral disease. So in full, it's called Parvovirus Enteritis, which means the enteritis there simply means it affects the intestinal tract. Now, affecting the intestinal tract, it leads to diarrhea. And if as humans we already know what diarrhea does to us, most times you have diarrhea and you visit the restroom up to 5 6 times in a day, and you know how weak you become. So it's the same with the pets. Once they have that diarrhea, and this time around it's not just coming as diarrhea, it's coming with bloody discharge with the feces. So now losing blood, losing fluid, you will see dehydration. Now that dehydration would entail that the dog becomes severely weak. With that weakness comes loss of appetite. There is loss of appetite, there's vomition. So it's a whole lot of chaos and a whole lot of symptoms. And it's not like parvovirus has a particular treatment. The treatment is done symptomatically. That means you can wake up this morning and you see vomition, and then the vet doctor starts to treat the vomition. Now, the next minute you might be thinking the vomition is gone, and then you now notice that, oh, there is actually a very very deadly diarrhea, a diarrhea that might not even just take, how do I don't want to be mentioning drugs now, but of course, you can take, for the humans you can just take flagyl and you're good. But for the pets, they are weaker. So it might not be something you just take flagyl for one day and then it's good. Sometimes this diarrhea takes them down for up to 1 week. Some of them stay up to 2 weeks and they are still not good. And in fact, after treatment, you still see most of them not eating. And then after treatment, most of the pets actually have to take a whole lot of time to recuperate and get back to being the energetic pets that they are. So it simply means that parvo is not something any of us should play with. And of course, Farmalert is at the forefront of ensuring that from the veterinarians down to the pet owners, that we do not see things that we would all be, well, let's say, sad about. So in the animal healthcare system, so with this comes the introduction of this very important and very breathtaking vaccine called Primodog. So I think Dr. Kayode had already mentioned it, and as he already said, Primodog is a monovalent vaccine, and with given at as early as fourth week. Most vaccines for the DHLPP would usually start at 6th week, but with Primodog it starts as early as fourth week, which means it's better because you get to prevent this virus from taking any form of effect on the puppy before it gets to 6th week. Now with that, you would just understand that Primodog is here to save the day. Primodog is here to do what has not been done, and that is why we are championing this campaign and saying that everyone has to join this campaign, starting from the veterinarians down to the pet owners, down to the breeders, and of course you as will I say the pet lovers. Tell your friends to tell your friends to tell your friends that there's a breathtaking vaccine that can actually save the day when it comes to parvo. Instead of waiting for it to come down with parvo, why not prevent? Of course, it's always said prevention is better than cure. So this is our prevention. Primodog is the prevention. And before I forget, Primodog is a German product, specifically produced by a pharmaceutical brand called Boehringer Ingelheim. So of course, anyone who searches Boehringer Ingelheim already knows that Boehringer Ingelheim does only quality. They do not produce whatever it is that will not bring the premium quality. Primodog offers you 90%, like complete 90%. It simply means it's giving you, in fact, 100% protection at this point. Really, if it can give up to 90% protection against parvo, that means you're sure that your puppy is safe and good to go when it comes to parvo. And of course, you would enjoy the puppy, you would enjoy it grow up, and you will see it grow old and all of that, and become very very homely as family. actually, because most people call their pets family. So that is it. Thank you very much.
All right, thank you so much, Dr. Nancy. Dr. Nancy is our country managing director, and by the way, she's just coming into the country partly for this campaign, and then we're happy to have you back, Dr. Nancy. So maybe before we hand over to our country managing director in Nigeria to talk to specifically the veterinarians and how the incentives we have for these campaigns across the country, let me just reiterate a few things. There's no vaccine like Primodog. So now I go to uh, breeders meetings, breeders conference, and there's virtually no breeder that is not afraid of Parvovirus Enteritis. It's not something that started yesterday. An average pet owner, and you could put a comment if on the chat box if you've had instances of loss of pets or your puppy due to parvovirus. Virtually everybody. I was in Liberia when we were about setting up Liberia, and I was talking to a particular pet owner, and the first thing he said is that he doesn't want to get his puppy as early as 3 months because he's afraid. He has lost quite a lot of puppies within those periods. Puppies are usually sold between 8 to 12 weeks. And those are the deadly times where once your puppies are infected with parvovirus, you are most likely going to lose them. So you're not just losing them, you're losing your money, you're losing your emotional attachment. The heartache is on, I wouldn't want to use the word uncountable, but the heartache is something you really don't want. So what's it? Now for this vaccine, we have something really very effective. The Primodog vaccine is an exclusive technology. It's not in any other vaccine. So if you're not doing Primodog, you're not doing any other thing. So it's exclusive. It's a prime vaccine. As Dr. Nancy mentioned, it's produced by one of the highest quality animal health company in the world, Boehringer Ingelheim. And it contains of all the strains of parvovirus that is circulating in Africa. So it contains 3 strains. It's effective against the 3 deadly strains of parvovirus. Most of the vaccines that you have available are not effective against all 3. Parvovirus is effective against all the 3. We can easily tell you can go to rest when you administer parvovirus. People also ask us, how do we administer parvovirus enteritis? Well, first of all, we advise that once you have your puppy as a breeder or as a pet owner or as a veterinarian, regardless of whichever category you fall into, the first thing you need to ensure is that intimate your vet. Intimate your vet. Once your puppy is getting to 4 to 6 weeks, in fact, from 4 weeks, get your vet and ask your vet, do you have Primodog in stock? If your vet don't have Primodog in stock, look for another vet that has Primodog in stock. It's a crime now for a vet not to have Primodog in stock, because we are having a campaign, a nationwide campaign against parvovirus. It's a deadly virus, but it can be solved. And the only vaccine currently that confers 90% protection against parvovirus is Primodog. So if you call a vet and the vet says he doesn't have Primodog in stock, I advise you to call another vet. But again, this is a public announcement, a public call to all veterinarians. We have distribution centers across the country, and all our distribution centers in Port Harcourt, in Abuja, in Lagos, in Kano, all of them have Primodog in stock. Buy 1 pack, buy 2 packs. Our CMD Nigeria will be telling you the incentives we have if you buy any of these packs, but have it in stock. Once you get your veterinarians and your puppy is approaching 4 to 6 weeks of age, then it's time to give your Primodog. Now, why do we also advise that you do the other DHLPP? DHLPP, distemper, hepatitis, leptospirosis, parvovirus, and parainfluenza. So the breeders are aware of the combinations of DHLPP across the country. That's what you're used to. So once you administer Primodog at first, your first shot, then wait for another 2 weeks and administer your regular DHLPP, probably at 8 weeks. So if you administer Primodog at 4 weeks, at 6 weeks you can do your normal DHLPP, and then you can conclude at probably 8 weeks with the other ones. But ideally 4 to 6 weeks for Primodog, at 8 weeks your normal DHLPP, and then you conclude your puppy vaccine at 10 weeks, and then of course you can do anti-rabies depending on what your vet advised and what's predominant in your region. So again, I summarize, there's no vaccine like Primodog. It's a crime for a vet not to stock Primodog. We advise all vets to stock Primodog. It is a technology that's exclusive to Boehringer Ingelheim, and we are one of the importers of these products. And then, of course, we can guarantee 90% protection against against parvovirus if you are well vaccinated against Primodog. We are open to your questions. You can start dropping your questions in the chat button, and then we're going to be attending to them one after the other. But again, we have an incentive, this 30 days, and this incentive is for these 30 days, right? We have mouth-watering gifts for all our partners. Our partners are veterinarians and pet store owners, agrovet stores across the country. We have over 1,000 of them that we're currently servicing. There's a small fund attached to it, and then I will be passing the mic to our country managing director, Nigeria, to tell you about what the mouth-watering offers are, and then we will start attending to your questions. Please, CMD Nigeria.
Thank you very much, sir. Hello, everyone. And this is Farm Alert. So this campaign, my name is Grace Samuel. I serve as the country managing director for Farm Alert Nigeria. So even as we strive to strike out Parvo in the system to ensure the animal health system is strengthened, we are also adding incentive to make it mouth-watery. Like it is a two-way win-win for everyone. In as much as you participate, we're here to serve you, and just walk into any of our centers. Are you in Port Harcourt? Are you in Lagos? We are there. Are you in Ibadan? Also, Kano, and here in Abuja. And of course, any neighboring states to these ones, you can always place your order and we'll deliver it fast. So all you need to do to be part of this incentive as we strive to strike out Parvo, even within this campaign period of 30 days, beginning from today till the 19th of November 2025. Then on the 20th, there's going to be a raffle draw. So what do you need to do? Just buy a pack of Primodog. So for every pack you purchase, it earns you a raffle ticket. So the more packs you buy, the more tickets you earn, the more your chances of winning the grand prizes. We have the first, second, and third prizes, and of course other consolation prizes. But when you buy more, you stand the higher your chances of being the prize winner. And we're going to be unveiling that on the 20th of November 2025 here in our office in Abuja. And of course it's going to be broadcasted the way this is going on. So even if you're in Lagos, you don't have to be worried. In Ibadan, Kano, or Port Harcourt, you'll all be part and parcel of this. All you just need to keep buying Primodogs, keep giving the vaccines and saving the puppies out there, and of course strengthening the animal health industry, and of course the entire human health in general. Because the less you have of this mortality for puppies, the less you have to bury, the less decay, the less release of all these gases into the atmosphere, and a cleaner and healthier environment for every one of us. So what are you waiting for? Just dash into any of our offices. The raffle tickets are waiting for you. Each pack of Primodog, remember, not just one, but a pack, is a pack of it that earns you a raffle ticket. And the more you buy, the more tickets you get, and the more your chances of getting the grand prize, maybe the second or the third, and of course there are several other consolation prizes. So we look forward to welcoming you to every one of our branches to pick up your Primodog, even as we all get towards a clean animal health industry. Thank you all.
All right. So thank you, CMD Nigeria. So you see, mouth-watering for all vets, agrovet stores. You can win a deep freezer, you can win a TV, you can win a gas cooker, and of course, other consolation prizes. So if you're there, we've been saying Primodog, Primodog. I want to quickly, before we start taking questions, Primodog is spelled Primodog, Primodog. And I want to say that if you're a pet owner or you intend to buy a puppy, before you purchase that puppy, tell them to take a picture of the green card and send to you. Once the stamp of a veterinarian and the stamp of Primodog is not on that card, my big advice is for you to tell the breeder no. I said, so if Primodog has a colleague in Nigeria, I will let you know. There's no vaccine with that technology in Nigeria currently. We are not promoting a product, we are promoting a solution. And once we have any other brand that has that level of solution, of course, because we're an animal health company, we'll be promoting that product. But since there's no technology as smart as Primodog currently, once you want to buy a puppy, what you need to do is to tell the breeder before he sends the puppy to take a picture of the data page of where the stamp is. As long as it's not a veterinarian administering that vaccine, or as long as you don't find the Primodol seal in that, of course you will see it written on the seal, the vaccine seal Primodol. Please know that your puppy is not 100% safe or Parvo, so that you don't lose your money and lose your income and then feel sad. Primodog is the breakthrough vaccine, and we are campaigning because we know that Parvovirus can be eradicated from Nigeria. The theme of this campaign is actually United Against Parvo. And so with you, with us, and with the veterinarians across the entire country, I believe it's going to be a win-win for every one of us. Dr. Nancy, you want to say something while we pick up questions online?
All right, I think a lot has been said. As Dr. Kayode rightly said, it's united against Parvo. So it's not us fighting Parvo now. It's the community, that which includes you as a pet owner, which includes you as a pet lover, which includes you as a veterinarian, as a para-veterinarian, and of course, we that are at the forefront of ensuring that veterinarians and agrovet stores have quality products to ensure that the animal healthcare system in Africa provides all that is needed for our animal healthcare system to be safe. So it's united against Parvo, and we are saying join us today for this campaign. Join us throughout the month for this campaign, and join us throughout the 30 days of this challenge to ensure that together we fight Parvo and ensure that Parvo is eradicated both in Nigeria and outside of Nigeria, across Africa generally. And of course, Dr. Kayode spelled Primodog. So if you look at our caps, you will definitely see Primodog. So it's a Primodog, it's a Primodog week, it's a Primodog month, and it's a Primodog 30 days. So join us in this 30 days as we do something very remarkable in the animal healthcare system. Thank you very much.
All right, so let's pick. All right, so let's pick questions online. If we are not able to attend all to the questions now in this live broadcast, there will be a few associates of ours online that will be responding to your question as we proceed. All right, so let's take a few questions.
All right, good morning. So the first question I have here is, can Parvo also affect humans too when they come in contact with a sick dog? Can it be transferred from the animal back to the humans?
All right, so unfortunately, or fortunately for us, parvovirus is not a zoonotic disease. So in terms of disease transfer from your puppy to you, no. But emotionally, I've seen people lose their puppy. I treated a client's dog, a highly placed official in Nigeria, and for 1 month she could not go to work. Sometimes some of these puppies, they are part of the family. So you might not be able to get a direct disease from them, but the emotional loss it causes you and the emotional damage that goes along with the loss of a puppy is not something anyone should play with. So again, ensure that once you're buying a puppy or if you have one, Primodog should be your first vaccine. Thank you.
Okay, thank you, Famalat, for this wonderful initiative. So my question is, what key strategies are in place to ensure this awareness campaign truly reaches dog owners across both rural and urban communities?
All right, so a fantastic question. I want to thank whoever has asked that question for bringing that up. So we are partnering with all partners across the country. We have over 1,000 of them. But more importantly, I think if you're listening and you own a dog community, just send us a message or come to the chat box, send us a message. Dr. Nancy will be dictating a number that will be on our chat box. If you can gather 50 pet owners and 50 dog breeders across the country, and for a meeting online, physical, across this entire length and breadth of Nigeria, just let us know. We will send in the closest resource person to you so that you can educate your community, educate the pet owners, educate the breeders, or educate whatever community that you have gathered. And this thing cannot be spread by just farm alert alone. This thing has a way of spreading if we all unite to ensure that everybody hears a word or two about parvovirus. So we need you need us, and we need the entire community. If you have any of those communities, just reach out to us and we'll be sending our nearest experts to those communities to educate you. Thank you.
All right, thank you so very much, Famalat, for this opportunity. I want to ask, can I give the vaccine to a sick dog?
So once a dog is sick, ideally you are not supposed to administer vaccine. Vaccines are meant to prevent. So if your pet is sick, please, we advise you contact your veterinarian. Your veterinarian is meant to give you the advice needed for you to scale through, but ideally you are not supposed to vaccinate a sick animal.
Okay, so my question also is, beyond awareness, how will this campaign help dog owners take real preventive actions, such as access to vaccination, treatment, or information support?
Have a veterinarian and ensure your veterinarian stocks Primodog. You will be able to counter the effects of parvovirus in a very short time.
Okay, so this question came with the comments and it says, thank you so much, Farm Alert, for this great initiative. It is actually a breakthrough vaccine indeed. But I would love to know, how many shots of Primodog can my dog take to prevent parvo from happening?
So you ideally need one shot between 4 to 6 weeks or 8 weeks, depending. But your first shot should be Primodog, and then your second shot 2 weeks after should be the normal DHLPP that you're all used to. But again, these are all public advice. I think I want to end this question because we're actually running out of time with the fact that you need a veterinarian by your side. A veterinarian is better able to advise you and to instruct you on what to do. If you have a veterinarian by your side, you can equally overcome a few of these technical questions that you're asking. I want to thank every one of you. We are running out of time. Just give Dr. Nancy 30 seconds to wrap this up. And of course, the country managing director, Madam Grace, to wrap this up in 30 seconds. And then we are done. But please, all your questions will be attended to online. People will be there. So keep it coming and we will be there to attend to it. Yes.
All right, thank you very much, and thank you for listening. Thank you for joining us, and thank you with the hope that we all understand the importance of this campaign in our community. Again, we have our branches scattered all over Nigeria, and of course, we have a branch in Liberia. But for Nigeria, once you are in need of this vaccine, as a vet, as an agrovet store, if you're in need of the vaccine, just call the number 0913 5000 435. And of course, this number, the person with it would always redirect you to either a veterinarian if you are a pet owner, or would redirect you as a vet or agrovet store to the nearest center that we have across Nigeria. We have branches in Lagos, Ibadan, Taraba, Kano, Abuja, of course, and in Port Harcourt. So you see, we are evenly spread and are very, very, very ready to serve you. So let's all join hands together to say no to Parvo using the preventive method, and of course using Primodog vaccine. Primodog is here. Primodog is in charge. Primodog for 30 days. Of course, we are all doing this together, and I say thank you again, and thank you for joining this campaign.
Thank you, Dr. Nancy.
So thank you, audience. We look forward to welcoming you, the veterinarians and the pet store owners, as you pick up your packs of Primodogs. The more you pick, the more chances you stand to win. So what are you waiting for? Come to Farm Alert. See you soon. United against Power.
All right, thank you. So to the country managing director, Nigeria, maybe for me, finally, I want to express my deepest heartfelt sadness for every one of you out there who have lost a puppy or two, or maybe even 10 or 20, and you don't know what to do to Parvo. My deepest heartfelt sadness. But again, we say no more. No more losses, no more death due to Parvo, because Primodog has come to save the day. Tell your colleague, tell your friends, tell your breeders, tell your veterinarians. If they are not, if your veterinarians are not stocking Primodog, they are wrong. They are wrong. And so, but you can encourage United against Parvo. We are going to stamp out our losses and then begin to count our blessings. All from all of us, I want to say thank you for the 30 minutes we have spent together. We hope it was useful, and then please follow us on all our social media handle, and let's keep keeping safe. United against Parvo. Thank you very much, and have a wonderful, wonderful morning. Thank you.